And Janelle, I would like to ask you to tell us about why there is a demand for digital tools providing or supporting delivery of health, relationships, and sexuality education. And it would be great if you provide us with some examples of different regional digital solutions and projects that reach young people directly or are used to enrich discussion in the classroom or organize health education. Over to you, Janelle.
Thank you for those great questions, Hoft. Well, to answer the question about why there would be a demand for such digital tools and platforms, I think we need to understand who that demand is coming from and who's really being targeted by these resources. So let's start with young people themselves, acknowledging that they are one of the main target audiences of digital health and sexuality education. And the reason that they're a primary audience in many country contexts is because of their unmet reproductive health and other well-being needs. Around the world, and certainly in Asia Pacific, where I work, young people continue to experience health and social challenges related to early and unintended pregnancy, sexuality, sexually transmitted infections, including HIV, early and forced marriage, gender-based violence, and many more pressing issues. And certainly, while we see an evolution in school-based programs on certainly comprehensive sexuality education, in very many countries, these are not yet implemented at scale or with consistent quality. And of course, we also have to respond to the needs of young people out of school who face even more risk and vulnerability. And actually, in 2019, UNESCO, UNFPA, and IPPF carried out a survey among more than 1,400 young people ages 15 to 24 from 27 Asia Pacific countries to ask them about their experiences of school based comprehensive sexuality education. Only 28% of that cohort felt that their school taught them about sexuality either very well or somewhat well. And about 46% felt that their teachers were either very comfortable or somewhat comfortable teaching sexuality topics. And when we asked them about their preferred sources of information about sexuality, 39% of them selected schools as compared to 55% choosing the internet and 56% choosing their peers. So I guess my first key message is that while we need to continue to invest in good quality school-based health and sexuality education, in parallel, we need to be reaching young people where they are with the kind of information that they need and that they want and delivered to them in the way that they prefer. And this is also important to those who are producing teaching and learning content on sexuality education, which is the other part of the who and the why equation. And in that same 2019 survey among Asia Pacific young people, when we asked about their digital practices relating to seeking information about sexuality, there's some interesting findings that came up. About the males in the sample, from the males in the sample, the behavior that was the highest among them was watching pornography at 68%, followed by chatting with strangers on social media at 45%. Among the females in that cohort, the behavior that was most reported was chatting with strangers on social media at 47%, followed by sexting at 40%. So this brings me to my second key message, that we need to increase the availability of and access to evidence-based, good quality, age and contextually appropriate digital content and sources on health and sexuality education, so that the opportunities of digital spaces outweigh any potential risks and harms. And this access has to be for young people and also for educators and healthcare professionals. Now, you asked me about some examples, and I'd like to respond to this question, Hoof and colleagues, with maybe a quick visual. So if you'll allow me just to bring up, colleagues, just 2 slides. With your help, we can just project those slides on screen. Fantastic, thank you. So we know that digital sexuality education platforms come in a variety of formats and with a mix of objectives. Some set out to explicitly inform, others predominantly to entertain, although most digital sexuality education platforms, certainly those that are especially successful, cover both of these dimensions and other dimensions as well. In 2020, UNESCO, UNFPA, and other partners organized an international symposium called Switched On, Sexuality Education in the Digital Space. And that event brought together more than 171 people from 54 countries to explore opportunities and challenges for capitalizing on digital spaces in order to better reach young people with good quality sexuality education that responds to their needs and interests. And actually, it was inspired by an earlier regional workshop from Asia Pacific called Turned On that was organized in Bangkok by UN partners in 2018. Now, as part of the 2020 International Symposium, we featured an exhibition of 29 digital sexuality education platforms from different countries in every geographic region of the world. And I've picked out just a few to mention in the short time of our webinar, and you see them on the screen. And these are a mix of platforms that use different media, sometimes even different technologies, not all online or web-based online, and they are run either by an individual or an organizational content creator. So on your screen, you can see a little bit about each of the four that I've picked out for you, the country, but also the platforms that they cover and the kind of engagement, audience engagement that they have. So we have Agents of Ishq from India. We have Hannah Witten from the United Kingdom. We have Love Matters Arabic in the Middle East and North Africa, and Tune Me covering sub-Saharan Africa. And all of these platforms set out to directly reach young people wherever they are with videos, with vlogs, social media shorts, digital postcards, and other packages of digital content. And while these platforms may be targeting young people directly, we also know that the other influential people in the lives of young people do reference some of these sources and resources to engage with the young people in their lives, including parents, caregivers, and educators. And that brings me to my second and final slide, which is to just acknowledge that one platform that has been picking up interest in Asia Pacific as a trusted source for evidence on sexuality education, especially among educators, is amaze.org by Advocates for Youth, who were also at the Switched On International Symposium and who have carried out partnerships and capacity building with both UN agencies, including my own office, as well as the Digital Sexuality Education Network of young content creators in Asia Pacific. UNESCO Bangkok has collaborated with Advocates for Youth to combine videos with lesson plans and discussion guides with orientations of the many different kinds of approaches and entry points for embedding these resources in classroom-based learning on CSE. And of course, we have Darcy from Advocates for Youth in the webinar today, and I'm excited for her to share more about that experience and the type of engagement and skills building that they do. Now, if you'd like to learn more about the Switched On exhibition, we have published the symposium posters online, and we've also produced a symposium meeting report, as well as a technical brief, a desk review of the evidence, as well as a background paper on primary data of young people's experiences with and their perceptions of digital sexuality education. Just a few of the products that are associated with that event.
And thank you so much, Jenelle. And one more question. What can you tell us a little bit what the advantages are of using digital tools like platforms and videos and applications in the classroom? And are there any limitations or risks of recommending learners to refer to online sources of information about health, sexuality, and relationships?
Thanks for that great follow-on question. Well, I'll just identify a couple. I mentioned a few already in the response to my previous two questions, and I know this will come up again actually during the course of the webinar. So some advantages, well, digital sexuality education or digital sources of information and education on health and sexuality can complement or they can enhance the delivery of school-based CSE programs where these are provided. They also do provide more relevant sexuality or health education where such education in school may actually be lacking. These kinds of platforms and resources can offer private, personalized, convenient, and more easily accessible answers to questions that young people may struggle to get from other sources. Mm-hmm. And of course, as we said, it can be a resource that directly reaches young people, or it can also be harnessed by educators in that type of engagement. Disadvantages, there are some. There's the potential exposure to harmful or inaccurate content by young people looking online for the information that they need, exposure to cyberbullying, sexual exploitation and grooming, contact with strangers, and sexual messaging. So all of these potential disadvantages really need to be paid attention to when we're creating spaces where we want young people to safely and ethically engage.
Mm.